This segment is sponsored by Fairfax Radiology. October is Breast Cancer Awareness Month, and we want to keep you all informed. That's why Ellen sat down with Dr. Elise Berman from Fairfax Radiology Centers and a recent mammogram patient to talk about why early detection is so crucial when it comes to saving lives.
Dr. Berman, let's first start with what is a mammogram? Like, what are you exactly looking for when you do a mammogram for someone?
So a mammogram is a low-dose X-ray, and it's the best test we have to find breast cancer early when it's most treatable.
Okay, and a lot of people haven't experienced this maybe. Can you kind of walk us through what it's like when you have a mammogram?
Absolutely, and we have somebody right here who can tell you firsthand. She recently had a mammogram. But basically, the technologist will ask a few questions. She'll get your history, then she'll do the mammogram. And the mammogram itself takes seconds. It's usually about 2 pictures of each breast. Sometimes the technologist might do an extra picture to get a little bit more tissue or if there's some motion. And then the specialized doctor will interpret the study and determine what the next steps are. And I know Marina just recently had an experience, and she can tell you firsthand what happened.
What was it like? Did it hurt?
You know what? It did not hurt at all. And I think that is the preconceived notion that a lot of young women have, that it is uncomfortable, it is painful, but with, you know, the expertise and the technology that Fairfax Radiology has, there was barely any discomfort. It was fast, convenient, so much knowledge I gained from just getting that service at Fairfax Radiology. And again, the technology has evolved so much from the time when our mothers got their first or second mammogram that there was barely any discomfort for me. So I'll definitely do it again, and I'll do it every single year.
Well, and you're at the right age for it, right? Was that kind of your reason for going in to have this first
I had several reasons. I just turned 40. I know I don't look like it, but I just turned 40, so it was the right time. But I have girlfriends who are alive and well, surviving breast cancer because of early detection. My father just recently got diagnosed with different type of cancer, and he is going to be alive and well because of early detection and early screening. That combination of all these factors kind of motivated me to finally, you know, take ownership of my own health and get it done. And I have 2 small children who will need me in 10, 20, 30, 40 years. And this is something truly that can make a big difference when it comes to treatment and saving my life. Yeah,
and 40 is the right age, right?
100%. She's absolutely correct. So there's a lot of confusion out there about when to start and how often to have a mammogram. And there is really uniform agreement that more lives are saved when women start getting a mammogram at the age of 40, just like you did, and have a mammogram every year after. So start at 40, have a mammogram every year.
Do you get the same questions from patients when they come in? Like, what are they most concerned about, I guess?
So I think that there's 2 main concerns, and I'm going to tell you one question that very few people ask that they should ask. So people are concerned about the discomfort during the mammogram, and most people tolerate the mammogram really well. It's not too bad, and it's a few seconds of having your breast squashed, and then they're concerned about the results. And the whole reason we're doing this is to find out if you have anything, and most people will have a normal mammogram. And for a few people who do need additional imaging, we'll do those extra pictures. We'll tell you exactly what we see after we've done that, and then you can feel, you know, much better that you have taken good care of yourself. And Marina can speak to some of that. And I'm going to tell you the third question that very few people ask that I think is probably a very important question, and that is, who is interpreting the mammogram that you get? So if you have a mammogram, it's really important to go to a facility where they're experts in that, where there are people who are going to look at the mammogram, who are specially trained in reading mammograms, and that's all that they do all day, every day.
Right, so you know that the results
are
what they are. Is there a peace of mind, Marina? I imagine the waiting period is like
I was actually one of those patients who needed the extra imaging after my first set, and there was couple seconds of just nervousness, of course, because again, as I said, I do have 2 small kids to take care of. But Dr. Berman and all the professionals at Fairfax Radiology were just so fantastic, walking me through, this is what is going to happen next, this is what we see. You know, are you at high risk? Are you not at high risk? So the knowledge and the comfort that they provide you throughout the process is just unlike anything else I've experienced. And luckily, I'm one of the fortunate ones who walked away with completely negative finding and results. So again, for the next 12 months, you know, I'm in a good place. Yeah.
And the early detection sounds like it's the key in order to be able to live that long life.
100%. The earlier we find the breast cancer, the easier it is to treat it, the better the outcomes are. And I think that's really the message we want to get across.
And that it doesn't really hurt. Thank you for telling me
so
that.
bad.
I won't be afraid when it's time. Thank you both for coming in today. We appreciate it.
Thank you.
To schedule a mammogram online, just go to fairfaxradiology.com or you can call to make an appointment. The number to call is 703-485-9628.